Hello, my name is Dr. Lucia Cagnes, board-certified OBGYN, streaming from the beautiful Cape Cod, Massachusetts. In this video today, we're going to talk about the mechanism by which HPV can cause cancer in humans. High-risk HPV has been associated to many different cancers in the population. High-risk HPV is extremely dangerous, especially the strain 16 and 18, been associated 70% to cervical cancer, 80% incidence of anogenital cancer, and 80% incidence of oral pharyngeal cancer. HPV, especially the high risk, has malignant potential. And the mechanism by which HPV causes cancer is shared by other oncogenic viruses. Viruses like hepatitis B and C, viruses like Epstein-Barr, they can create cancer in humans. One of the main goals of these viruses is to reproduce or replicate themselves in very large copies. In order to do so, the virus has to penetrate the nucleus of the host cells where the genetic material is mostly contained and integrate with the DNA of the host cells in order to change the information, the instruction, to the DNA. The ability to integrate with the DNA is what makes the virus extremely dangerous. Penetrating the nucleus, the virus genetic material integrate with the DNA and give instruction to the cell to produce as many copies of the virus as possible. We call these copies virions. What happens is the cells start becoming active as well and start the process of producing all the genetic parts that are necessary to assemble the virus itself. Normally, the cells in the tissue they has been infected with HPV virus are very quiet. These are cells that reach a level of maturity, and they are just there basically to protect the tissue against external factors. But those cells are not active anymore, and eventually will die and be shed by the body that produce always new cells to replace them. The fact that the cell changes from being extremely quiet to a very active state is very abnormal. And the cells have been infected by an active HPV, they start looking abnormal as well. One of the common early abnormality is for the cell to look atypical. And there are different kinds of atypia. Most common is the squamous atypia. In the atypia, the nucleus where all the activity is happening becomes larger. So there is a ratio between the size of the nucleus and the size of the cells that is definitely favoring the size of the nucleus, and the cell looks abnormal because it is abnormal. When the abnormality gets worse, we go from just an atypical state to a dysplastic state. Dysplasia is definitely a precancerous lesion of the tissue where the cells look more and more abnormal. There are three different grades of dysplasia: the mild dysplasia, moderate dysplasia, and severe dysplasia. In the severe dysplasia, the cells look just like cancerous cells. They're extremely abnormal, bizarre looking, but this is still a precancerous lesion because these cells don't have the ability to spread far in the body through the lymphatic system or the blood vessel like a cancerous cells does, but they do just grow locally, creating most of the time a tumor, a mass, a growth that can be detected by an exam. It's extremely important to detect this abnormality early on. This is called secondary prevention, and it's extremely important to treat this lesion early on before they could degenerate into cancer. It takes about 8 years for a lesion to become cancerous if has been totally neglected in the body. There are some proteins the HPV virus produce. They represent a marker of the viral activity. These proteins are called E6 and E7. And we have ways to detect these markers in the pap smear, but the provider has to request this test specifically. It is extremely important to, once the detection of an active virus and the presence of these markers has been proven in the pap smear, to proceed with the diagnostic tool represented by the colposcopy. Colposcopy is an exam of the tissue with a microscope or magnifying glass that will help the provider to detect the presence of the lesion, identify the presence of the lesion. Once the lesion has been detected, it's important to either monitor the lesion over time or treat the lesion depending on the severity of the precancerous lesion that has been identified. High-risk HPV is definitely a game changer. It has to be monitored very closely with repeat pap smear or other diagnostic procedure like the colposcopy. Early detection and treatment is the key in preventing cancer formation in humans. I will refer to other videos on my YouTube channel about specifically colposcopy and precancerous lesion. So please look into the library to find more specific videos about this subject. Thank you for listening and stay tuned.